Hey guys, so this is the case studies video for chapter 17 and 18 for OT 63. So for chapter 17 you have the odd case studies. Case study number 1 is in SOAP note format. Let me push this up here a little bit for you. And I started to do this when we were in class earlier. 15-year-old male presents with acne. Patient says that he has had continual breakouts over the last 6 months, which appear to the patient to be getting worse. He tries not to touch his face and washes it 3 or 4 times a day. So here's his objective assessment and plan. Patient will wash once in the morning. And again before bedtime with a mild soap, followed by Differin every night, and we'll start doxycycline once a day, 100 milligrams by mouth every day. He will return in 1 month for follow-up. So his diagnosis can be found in the objective up here, which is examination, and he has acne lesions. So acne is going to be his diagnosis, and that is going to be what you look up here. Alright, so let me flip the page. Okay, so for case 3, patient presents with a complaint of pain in left hand, has been running a low-grade fever. So, let me read through here. Left hand, touch, cuticle lifts away from the base, pus present. Okay, so this is going to be the diagnosis, bronchia. I think when you look this up, I could be wrong, but I think when you look this up, it's going to tell you also maybe C. cellulitis for the digit, or it may say C. also cellulitis or something like that. So you then may want to look up like cellulitis of a digit or cellulitis for the finger or something like that. So that'd be case 3. So let me flip over to case 5. Okay, test presented today with a complaint of burning, itching around her abdominal scar. Scars result in an automobile accident 3 years ago, 15 centimeters length. To be a keloid. Okay. Steroid injection. Don't need to code the injection for this class. Okay, so then you're going to code the keloid scar. And then for case 7, a logger, huh? Alright, so here's gangrenous. So that's going to be your second code. So the abscess is going to be the first code. Sorry, you probably hear all my loud kids in the background. So your first code is going to be an abscess. The finger. And then the second one will be for the gangrene. I think we talked about this earlier in class today. Alright, so then case 9, let me flip over there. Alright, case 9, 18-year-old male patient. Compress. Okay, so he has a sebaceous cyst. So you're going to look up cyst, and then sebaceous. I think it's E-O-U-S. Okay. And that should be it for Chapter 17. So let me flip over to Chapter 18 and we'll go through those. Okay, so Chapter 18 is diseases of the musculoskeletal system and connective tissues. So let me flip to those case studies. Here we go. And you will have the even case studies. And we will start with case 2, which is an ER visit. A 16-year-old female running a track practice today started experiencing foot pain. Current past was runs, but today is increased level. So, X-ray ordered, clinical diagnosis, stress fracture, second toe, left foot confirmed by X-ray. Pretty straightforward and easy. So you're going to look up fracture. Then stress, then toe. And that'll be for case 2. So I'm going to flip over to case 4. Case 4 is a physician's office visit. Mark presents today for follow-up for a torn meniscus. Injury occurred 2 years ago. Downhill, fell, twisted his right knee during his fall. He was in a wheelchair for 2 weeks, moved to crutches, physical therapy. Now walking and performing activities of daily living without assistance. Diagnosis given for today's visit is an old bucket handle tear of medial meniscus of the right knee. So his diagnosis will be tear, then meniscus, then old, because it's an old injury. And there will be a note there to see derangement. Then go to the knee. Meniscus due to old tear. So check that. Okay, so that's case 4. Let me flip over to case 6. Alright, case 6, physician's office note, 54-year-old patient returns to the office following today to follow up on degenerative arthritis, present left elbow. Ordering an X-ray to determine if there's narrowing of the joint space. Offered corticosteroid injection. Surgery apply heat to the joint. Okay, so she has degenerative arthritis. So that's what we're going to look up. That is also called osteoarthritis. So you can either look up arthritis degenerative, or you can look up osteoarthritis. Save you some time, I would probably look up osteoarthritis. Let me bring this down a little, sorry. But I'll also put in here degenerative arthritis in parentheses, so that and that would be 1 and then 2 here, so you know to look up arthritis first, then degenerative if you're going to look that one up. But osteoarthritis I think would do the trick there. Alright, so for case 8 down here at the very bottom, let me move that up. Let me read that. On exam, limitation of straight leg raising. Her assessment is sciatica with lumbago. So that's what we're going to look up. Exactly. That's exactly what we're going to look up. Pretty easy. And then let me flip over to case 10. 46-year-old male carpenter presents to the office today complaining of pain in his right thigh area, which has increased throughout the day. Exam showed no limitations in range of motion or reflex. His skin is intact. Neurological exam is within normal limits. Instructed him to heat the area and take Tylenol for the pain. Okay, so his pain will be his diagnosis then, and it will be pain in the leg, pain and leg, which I believe you're going to have to narrow down to pain in the limb, which will be specified to the lower limb, and then even down to there may be laterality in there. I'm not sure if there's a right or left, but if there is, of course, you'll want to select the right. And then you may want to even look for thigh for this one also. So I'm going to put a little note in here to, I don't know, but check for laterality digits. So that may be something that you need to look up in the tab list, in the tabular list. Okay, so that is it for 17 and 18. If you have questions, then let me know. Thanks.